Why finding assistance with your Medicare enrollment may be difficult this year. Hello, I am Kevin Knaus, an independent health insurance agent and certified to represent Medicare Advantage and Part D prescription drug plans. And myself and many other agents across the country learned shortly after the annual enrollment period for 2025 started that hundreds, thousands of plans have been deemed non-commissionable. They will not pay a commission to the agent for the enrollment. They have been decommissioned. And this has left a lot of agents scratching their heads thinking, well, if I'm not earning a commission, how do I get compensated for my time? And the plan sponsors, that's what we call them, plan sponsors, the insurance companies, they kind of change the rules midstream, and we just don't understand what's going on. And so a lot of agents are pulling back, saying, I can't help as many people, I can't answer the phones as much, and I need to take a different tack on how I earn a living. Now, agents that become certified to sell Medicare products have to go through a national training, AHIP, and it costs $175 and takes many hours to get through the training of all of the Medicare stuff. And then after you pass that test, we then have to pass a test, certification, do the studying for each individual plan sponsor. And all of that studying can be 2 to 3 hours per plan sponsor. So there's a lot of time invested. In California, we have 15, 20 different plan sponsors. I represent 8 of them. So I calculate that I have probably over 30 hours of study time. And many agents are in the same position. And it's like, wow, I put in all that time and the plans just say, nah, we're not going to pay you a commission. Now, the average commission for a Part D prescription drug plan enrollment is between $50 and $100, one time for the year. A Medicare Advantage plan in California for a new enrollment is about $750. They call it one and done. So once you get paid, that's it. And it can actually be prorated if someone enrolls later in the year or if someone switches their plan right after they enroll. It's a rapid disenrollment, so you get paid nothing. So, but those, that's just kind of the landscape. To have so many plans just come out and say, we're not paying a commission, period, that is a completely different situation for many agents. Because when we assist someone, it's just not meeting with them and selling them something. You have to take time as an agent to gather their information, the doctors, the hospitals, the prescriptions, and the prescriptions is probably the most difficult part because we need to get all those prescriptions and get them into the system, make sure we have the prescription correct, the dosage, the frequency, the packaging. Is it a solution? Is it a gel? Is it a caplet? Is it a tablet? Because all of those things can change the drug cost. So a lot of time is spent getting all that stuff into the system to get an accurate estimate of what the drugs will cost by the different plans that are available to the Medicare beneficiary in the year. So here's an example. I went and met with a wonderful couple, spent over 2 hours with them and reviewed their prescriptions, put them into the system, went through, checked, made sure the pharmacy was in network, and did the whole analysis. And the best fit for them were a drug plan that I make no commission on. Now, the 2 slices of pumpkin bread that I was offered and ate were delicious. The coffee that was offered to me was great. And that was my compensation for 2-3 hours of work. I don't regret it. They're wonderful people and I help them. But how often can I do that? How often can any agent do that? When you find the best plan for the Medicare beneficiary, but you're not compensated for it, you start to think about how you market yourself and how you reach out with different people to make those connections to offer that Medicare assistance. So the flip side of this from the marketing and sales department of these plan sponsors is, well, only, offer them the plans that you make a commission on. Well, most of those plans have a higher premium on them, and it may not be the best plan for them. And when we go through our Medicare training, it is drilled into us that as an agent, you are working for that client and you enroll them in a plan that's best for them. Not best for your pocketbook, best for them. So, trying to upsell someone on a $50 or a $60 per month prescription drug plan when there's one that's much lower that does the same thing with drug costs that are the same or lower, that doesn't make any sense. Another issue that goes into it is that all of the drug plans for 2025 have a cap of $2,000. That's the maximum out of pocket. Once someone hits $2,000 in drug costs, they're done for the year. The plan pays for everything. So if the individual in a high cost prescription drug plan hits their maximum out of pocket in the middle of the year, they're still paying that high premium for the remainder of the year. If they're in a lower cost, lower monthly premium plan, and they hit their maximum out of pocket in the middle of the year, they're paying a lower premium for the remainder of the year, and they know no difference. All of their drugs are being paid for because they've hit their maximum out of pocket. So now they're just paying these high premiums if they're in a high premium plan. So that doesn't necessarily make any sense. So a lot of this has changed. The strategy for enrollments has changed on the part of the beneficiary. And maybe that's why they decommission so many of these products, because it really looks like, just take the lowest and you're going to be covered. Now, there are some differences in there. Some of the pharmacies aren't in all the different drug plans. If you have a favorite pharmacy and pharmacist, you want to have that in network. And if it's part of a Medicare Advantage plan, you want certain doctors and hospitals in there. So there's some other considerations. But when agents look at the landscape of the plans they represent, and if they will be compensated for the time it takes to enroll someone, a proper enrollment where the person's healthcare needs and prescription drugs and everything is completely analyzed, sometimes it doesn't make sense for the agent. I'm just going to go forward. I really can't do anything about it. And if someone calls me, I'll help them. And I think most other agents will too. But there may be some parts of the country and here in California where agents just won't call you back. They just don't have the time. They got to deal with their existing client base. And if the prospect is such that they can spend 2 hours and not be compensated, they're going to suppress their availability for new enrollments. So that's kind of the landscape. So if agents aren't calling you back, you can't get anyone to help you, that might be part of the problem, is that many of the plans have been decommissioned and there's really no livable wage for the agent with many of the Medicare plans for 2025. So if you have any questions or comments, you may leave those down below and I will do my best to answer them. Otherwise, for InsureMeKevin.com, I'm Kevin Knaus.